Welcome, everyone, and thank you for joining us today. And by the way, happy Social Service Workforce Week. I'm Catherine Conley-Wehrman, and I serve as the Alliance Steering Committee Chair and as your moderator for today's event. This year's Alliance's annual symposium is an especially important one because it is our 10-year anniversary as an alliance. To commemorate the occasion, we will be time traveling back to the landmark Social Welfare Workforce Strengthening Conference held in Cape Town, South Africa, nearly 13 years ago. This conference marked the launch of a global movement to strengthen the social service workforce and underscored a critical need to continue efforts to bring together global stakeholders engaged in workforce strengthening for discourse and knowledge exchange to support an ongoing effort to build the evidence base around effective social service workforce strengthening practices. The Global Social Service Workforce Alliance was proposed as a way to address these needs, and thanks to a generous grant or support of the U.S. President's Emergency Plan for AIDS Relief, or PEPFAR, we were officially launched in 2013. Since then, through the generous support of PEPFAR, USAID, UNICEF, GHR Foundation, UBS Optimus, and Rockefeller Foundation, the Alliance has united more than 3,500 individual members engaged in workforce strengthening from across 150 countries. It's produced nearly 30 technical resources to support global efforts to plan, develop, and support the workforce, has worked with over 40 national governments to develop plans and initiatives to strengthen their social service workforce, has hosted nearly 50 webinars and 8 symposia to share promising approaches to workforce strengthening across the globe, has advocated for increased support for the workforce by hosting Social Service Workforce Week, as just a few examples. So at our next slide, we would like to share a little bit more about who's attending with us today. We have over 450 individuals registered, coming from 89 different countries. The top 10 countries with individuals represented here include the US, Uganda, Kenya, South Africa, Nigeria, India, Indonesia, Philippines, UK, and Democratic Republic of the Congo. I mean, several more countries we'll hear from. We would love it if you would use the chat feature at the bottom of your screen to introduce yourself. Meanwhile, we'll also be completing 2 poll questions to learn a bit more about each of you in attendance today. I think you see on your screen a poll question that's popped up. Please select which type of organization you work with, and keep in mind you can select more than one. So I'll give you a chance to do that, and then we'll look at the results. Not seeing results yet, so I'll go on. We'll also see a second poll question in a little bit. Here we go. It looks like academic research institutions and non-governmental organizations are kind of tied, with non-governmental organizations out a little bit ahead. But we have civil society groups, government, and independent consultants. Okay, do we have the next poll question to put up? When it comes up, we'll go ahead and do that. In the meantime, I want to go ahead and go over, here it is. Here's our poll. We'd like to know how long you've been a member of the Alliance, or if you are a member. And And we'll wait a second to see what our responses are. Okay, and it looks like we have several who are not yet members. Notice I say not yet. We hope you will join us, and several who have been a member for over 4 years. Thank you. Thank you for that information. That helps us. In terms of webinar logistics, you saw that we're going to ask, well, the slides will catch. Here we go. Please submit questions for our presenters through the Q&A function or button at the bottom of your screen. Also, you feel free to use the chat button to introduce yourself, as I mentioned earlier. And note that our webinar will be recorded and will be made available on our Alliance website. Okay. We are going to have a Jamboard going throughout our events, so please use a blank sticky note to make any contribution about key achievements to strengthening the social service workforce over the past decade in your country or context. And we'd like it if you would note any contribution of the Alliance in those efforts. All you need to do is double-click on a blank sticky note to insert your contribution. Okay. It's easy to become a member. You can just take a look at the instructions here, but understand being a member offers many opportunities to engage and be a part of efforts for strengthening the social service workforce. So please explore that and become a member if you're not already. Okay. I think we're about ready then to review our agenda for today. We will be, just a brief overview for you, we will be having opening remarks, and we're very pleased she can be here with us, from Rebecca Levy, of U.S. Government Special Advisor on Children in Adversity. In our first session, we will be doing our time travel, the retrospective of Cape Town Conference. Ian Milligan of Celsus will be our moderator, and the panel will include Amy Best, former director of the Alliance, Grace Mayanja, Chief of Party, USAID, Caring for Vulnerable Children, Maury Mendenhall, also of USAID, Office of HIV/AIDS, and Zeni Thumbadu, Deputy Director, National Association of Child Care Workers in South Africa. Next slide. In session 2, Hugh Salmon, our director, will be looking at the Alliance across the years. The third session is focused on country-level progress and workforce strengthening, and will feature Florin Lazar of the University of Bucharest, Romania, Lon Lahong of Vietnam, UNICEF, and Leon Luwani, Chief of Child Protection, UNICEF, Rwanda. Hugh will return for discussion of future priorities, and we're honored to have closing remarks by Shima Sengupta, Director, Child Protection Program, UNICEF. Okay, I think you've received the link for Jamboard, and so we should be ready to go. At this point, I will turn our symposium over to Rebecca Levy. Rebecca?
Thank you so much, Kathy, and good morning, good afternoon, good evening to everyone joining from around the world. I am so happy to be here today to celebrate the 10th anniversary of the Global Social Service Workforce Alliance and to recognize the progress that has been made to strengthen the social service workforce since the groundbreaking Social Welfare Workforce Strengthening Conference that was held in Cape Town in 2010. As Kathy mentioned, that conference was instrumental to launching the global movement to strengthen the social service workforce and develop stronger, more effective social service systems. And since I'm calling in from DC at 8:09 in the morning, you might hear my children in the background getting ready for school, so I apologize for that. Usually I am either in the office or they're out of the house already. So I have the privilege now of serving as the US government special advisor for children in adversity. And in that role, I lead implementation of the Advancing Protection and Care for Children in Adversity strategy, or APCA for short, which is the US government's commitment to investing in the development, care, dignity, and safety of the world's most vulnerable children and their families. Among other things, APCA recognizes the critical role of the social service workforce in supporting vulnerable families and ensuring protection and care for children. Leading up to the 2010 Cape Town conference, the number of children subjected to abuse, violence, exploitation, neglect, and family separation was causing great concern. Yet globally, we knew the workforce charged to care and protect them was often overlooked, understaffed, and underfunded. Social work was one of the most misunderstood and underappreciated professions, and the wider social service sector struggled to attract and retain qualified workers. In fact, vacancy rates for professional and paraprofessional social service positions within Africa were between 50 and 60%, and half of those employed were leaving their jobs within 5 years. Each of these statistics indicated a global crisis within the systems that care for and support the most at-risk children and families, and a serious threat to global development. It was against this background in November 2010 that PEPFAR, under the auspices of the Technical Working Group for Children Orphaned and Made Vulnerable by HIV/AIDS, organized the Cape Town Conference. And the aim was to highlight the crisis and explore strategies for addressing it at the country and global level. The conference brought together teams from 18 countries to discuss and share experiences around the challenges facing social service workforce and to develop concrete action plans to address these challenges. The idea for a global social service workforce alliance was one key innovation that stemmed from the conference. It was conceived as a means to develop and share knowledge and facilitate ongoing support for those engaged in workforce strengthening. Today, in addition to hearing more about the Alliance's work since it officially launched in 2013, we'll hear other examples of the impact the conference had at the country and global level. The Cape Town Conference was part of a long-term effort by the US government to draw increased attention to and mobilize additional assistance for the social service workforce. As I mentioned, our APCA strategy recognizes that in order to achieve a world in which all children thrive within protective, loving families, free from deprivation, violence, and danger, we must have an effective, well-resourced social service and child protection system. And at the heart of those systems is a strong social service workforce. This is why strengthening social service workforce is a central component of many of the initiatives that we support, and I'll highlight just a few, but I know you'll hear about so much more work today as well. Within our child protection and care systems efforts, our partners are strengthening social service workforce in Armenia, Cambodia, Ethiopia, Ghana, Guatemala, Kenya, Moldova, Rwanda, and Uganda. As you'll hear later today, in partnership with the government of Rwanda and UNICEF, through the Let's Raise Children and Families program, care reform has been a critical entry point to develop, train, and support the professional and paraprofessional social service workforce at all levels. In Eastern and Southern Africa, we're partnering with UNICEF to build the investment case for the social service workforce in Kenya and Zambia, as well as strengthening the quality assurance systems for the social service workforce for child protection across the region. And our USAID-funded Data for Impact project has assessed activities in planning, developing, and supporting the social service workforce across 3 countries to identify promising approaches to strengthen the social service workforce and broader systems related to care and protection. And of course, we are so thrilled to count the Global Social Service Workforce Alliance as one of our global partners and to support its essential work to ensure that the workforce is well planned, developed, and supported in communities across the globe. While the Cape Town Conference helped ignite a global movement to strengthen the workforce, we know that our work is far from complete. We have to continue the momentum and work to ensure this critical workforce is backed by proper political, financial, technical, and moral support, and well-equipped to face the challenges of today and the future, ranging from the impacts of climate change on children and families conflict and displacement, to deepening levels of inequality and social inclusion in many countries. I am so glad to be here today, and I'm really looking forward to today's discussion to learn more about our key achievements over the decade and future priorities in light of the challenges of today and for the next decade. Thank you so much for inviting me to be here. And with that, I'll turn it back to you, Kathy.
Thank you, Rebecca. And thank you so much for taking the time to be with us this morning to kick us off. We really appreciate it. At this point, I'd like to turn to our moderator for the first panel, Ian Milligan. Ian?
Thank you, Kathy. It's great to be here. Hello, colleagues all over the globe, which is wonderful. I'm here to chair this or moderate this panel about the impact of this conference that you've been hearing named already this morning, 13 years ago. And so I'm going to facilitate a very informal conversation between four of the folk who were there. So let's start by getting them to introduce themselves with their name or their current role and their involvement in the conference way back when. So I'm going to start with Maury. Tell us about yourself, Maury.
Great. Well, I'm Maury Mendenhall. I work at the Office of HIV/AIDS in the United States Agency for International Development. And I focus specifically on children orphaned and made vulnerable by HIV/AIDS. And I had the great opportunity to develop and to attend this conference such a long time ago, 13 years ago now. And do you want me to keep talking about myself, or should I talk a little bit about the conference?
Why not just say something about the conference, because you're involved in helping set it up?
Sure, great. Well, yes, it seems like such a long time ago. I was much younger then, but I'm remembering when I was in middle school and high school as well. And I remember that HIV/AIDS, when I was growing up, I don't know when the rest of you grew up, but this was a very, very scary thing. It's still scary, but when I graduated from college, I went to Zimbabwe, and I remember making friends there. And by the time I left, my friends had died. And I was primarily working with children there. And I think there was this recognition that children were dying too. But some children, when they did survive, many of their caregivers had died, their teachers had died, government officials, people who were supposed to support them, they had died as well. Children were in really dire circumstances. And so when the United States government started the President's Emergency Plan for AIDS Relief, PEPFAR, the idea was, of course, to make sure that people who were HIV positive had access to medication, that the health facilities were able to support them. But there were some very intelligent people that also recognized that children, even those that had not were not HIV positive, that they really needed a lot of help too, that this had really affected them in some pretty significant ways. And so when I joined USAID and started working with children orphaned and made vulnerable by HIV/AIDS, I remember that social service workers were the most important people that were supporting those kids. And when we had projects that were supporting those kids, we absolutely needed people that could provide case management, people that could check in on kids, could check in on the people that were working with those kids, and make sure that they were going to school, and make sure that we were making sure that they were healthy. And many of those social service workers were volunteers at that point. I started at USAID in 2009, and my colleague Gretchen Bachman, she was the one that recognized that these social service workers, we needed, they were just such an important kind of component of what we were doing. We needed to make sure that they had all the resources that they needed, and we were just
Maury,
doing the best we
I
could.
think that is great background, but I want to just steer around to Amy, because I think she can build on what you've been saying. And so over to you, Amy, to introduce yourself and the development of the conference.
Thanks, Ian. I'm Amy Best, and I'm the former director of the Global Social Service Workforce Alliance. In 2010, at the time of the Cape Town conference, I was working at the National Association of Social Workers in the US. They had a Human Rights and International Affairs division at that time. And Maury and I got talking at one point at a conference, at a workshop. And anyway, the alliance was, the National Association of Social Workers was contracted to help organize the Cape Town conference. So I worked a lot with Maury on getting the conference all put together and organized. And I guess we'll talk in a minute about the kind of why and how, but that's my basic introduction.
Great. Let's hear from Zeni, because we've heard already about people who were social workers, but the key phrase we've got here is social service workforce, made up of many parts. And a crucial representative and leader of one of the other parts, apart from social workers, is Zeni. So tell us a little more about yourself and back at that conference, Zeni. You're on mute.
My name is Zeni Thambadu, and I represent the National Association of Child and Youth Care Workers in South Africa. And at the conference that was held in Cape Town, I was part of the South African delegation representing the child and youth care sector, with a multidisciplinary and intersectoral team that got together to look at how would we continue the transformation of child and youth care services in South Africa. We were very excited at the conference to see the focus on the importance of professional associations. And I had the opportunity to present as well on the Izibindi model, which is a model where child and youth care workers were moving from residential care facilities into communities to provide early intervention and prevention services through home visiting programs and supporting the AIDS pandemic then. So that was my I think exciting first connection with the Global Alliance and the team here.
Thank you, Zeni. Now over to Grace.
Thank you. So my name is Grace Mayanja. I'm based in Ethiopia and currently serving as, working with FHI 360, serving as Chief of Party for a USAID-funded Orphans and Vulnerable Children activity. I attended the 2010 conference while based in Uganda at the time. At the time I was working with an international NGO called International HIV/AIDS Alliance. I was working as a chief of party on a USAID-funded project that focused on strengthening social service systems for the government of Uganda. So I was part of the Uganda delegation, and the members of the delegation included myself, of course, from an international NGO, others from USAID. We had members from the government of Uganda's Ministry of Gender, Labor and Social Development, and we had members from UNICEF. So on the delegation, I was like Uganda. I was the implementation lead on that delegation. So I was really heavily invested in the conference. I remember very well, of course, Maury with her passion. She was really, as she said, very young at that time, very smart lady, very passionate about social service workforce. She really made me feel like fit in the way she really, and everybody else that was presenting at that time talked about how important the social service workforce is and the critical role that it plays in making the world a better place for children. We really, as a Uganda delegation, we were very vested in the conference, and it really helped a lot to shape our social service system strengthening activity.
Great. Thank you, Grace. That's a wonderful contribution to help convey some of the tone of the conference, the passion that Maury and others have brought to it, but also this bringing together people from different sectors. I feel this leads us on to asking you, Amy, maybe to pick up on this business of what you felt were some of the key considerations of the conference. What were some of the things, key ideas that had gone into it?
Yeah, well, up until that time, there had been a lot of focus on good programming for children affected by HIV and AIDS, and some best practices and programs, but not so much on the social service workforce and the people carrying out those programs. And so the idea of the conference was really to put a spotlight on some of those efforts that were happening. They were, a number of countries really had great initiatives to focus on the social service workforce, but they weren't really getting much attention. There wasn't a lot of opportunity for different countries to learn from one another about what was happening and what was working well. And so the conference was designed in a way to create country teams. As Maury was reaching out to a lot of people within the different countries, realizing that it wasn't always the case that the government ministry representative from the social welfare ministry knew the person from UNICEF or knew the person from the National Association or knew the head of the major NGOs that were working in this space in a particular country. And so the country team idea was a way to bring people together within countries from NGOs, government, national associations, universities, as well as some of the major donors in this space, which was UNICEF primarily and PEPFAR at the time. And so these country teams were formed. In many countries, they had meetings prior to attending the conference. And then at the conference, there was a lot of time for interaction between the teams to really learn from one another, and also to get a lot of feedback from participants about what they wanted to see happen next. So it was a very kind of dynamic conference. There was a lot of time for these country teams to meet and to reflect on the presentations from that day, and to come up with a plan for moving forward within that country. But then also at the global level, the conference participants came out with a very strong recommendation that these conversations continue in some way, and that an opportunity be created so that everyone could continue to learn from one another, so that the NGOs in Tanzania could keep learning from what's happening in South Africa and vice versa. And so that's where the idea of the Alliance came from, was from the conference participants to create a network to keep going.
Okay, Amy, you've kind of stepped ahead a little bit about the development of the Alliance, but that's fine because all this stuff is connected. But I'd like any of the others to chip in to this question that you were addressing, and about the conference itself again. What were some of the key learnings, any of the other three of you, from the conference? We've heard from Amy about you were given time to meet in country teams, as well as hearing the plenary conversations and the addresses. But for you, thinking back to that time, what were some of the key learnings for you? So anyone chip in.
Well, I think that for me, if I could just say that the importance of working together in multidisciplinary teams to recognize the value and contribution of the competencies of different professions and different sectors coming together, because a lot of the work that we do in the child protection sector requires a range of different stakeholders to come together. So it set that vision for us. And when we continued with demonstrating the role of child and youth care workers in communities in partnership with the government, with UNICEF, with South African other NGOs, we had the opportunity to work together to service children in ways that were better. I think the other issue is the issue of recognition of the para worker, the para-social service worker. And in South Africa, we put effort into demonstrating the role of auxiliary child and youth care workers and child and youth care workers in community settings, and forge their recognition. We have the South African Council for Social Service Profession that has now recognized the Professional Board for Child and Youth Care, and there's a statutory recognition of child and youth care workers as an equal profession to social work, functioning, of course, at two levels: the professional level, the degree childcare workers, and at the para level.
Great. That's helpful, Zeni, because I'll take a moment just to say that for folk who don't know, this child and youth care profession is particularly well developed in South Africa and Canada, just for different historical reasons. Also a significant presence in the US, although not so much at the wide national or professionalized level. And of course, many of these workers are found in every country in the world. But the child and youth care is a specific profession that is developing in a number of different places. And also this concept, a word that many of us have heard about, the paraprofessional, which surfaced during this conference, the importance of these other sectors, the other employment sectors, and indeed volunteers. So I don't know if Grace or Maury, you want to follow up that thread, or if there's some other contribution you want to make in terms of my question about what were the learnings for you from this conference. So either of you want to come in on that?
Can I get started? And then I want to toss this to Grace, because one of the things that I just remember being so excited about at the conference is the plans that countries came up with. When I go to conferences, I feel like I come up with a lot of great ideas, and sometimes I follow through and sometimes I don't. But I was surprised how many countries did follow through on these plans. So, you know, at the end of each day, countries would talk about what they had learned during that day, some of the challenges that they recognized that they were facing, some help they needed from other people in their country. And then they said, okay, this is what we're going to do, and this is the deadline, and this is who is going to do what. And I'm remembering, Grace, that your country, Uganda, that you came up with a really concrete plan and you followed through, and it was so exciting. And I think you should talk about that. And now that you're in Ethiopia, again, that was a team that stayed together for a long time. It was like going to camp and meeting your best friends, and they continued to get together, you know, on a weekly basis, a monthly basis, and started parasocial workers in Ethiopia as well. And you are now a part of those teams that continued working on that.
Sure, absolutely. So this conference, I think, was one of the best things that ever happened to Uganda at that time. It was just so timely. And so the teams worked together. One of the biggest highlights of the learnings for me and with the team was to realize where we needed to start. As I did mention, Uganda was embarking on a social service system strengthening activity to strengthen the capacity for the implementation of the national policy on orphans and vulnerable children that have been running. But now Uganda was trying to build the capacity of the local government and community social service systems. But I don't think we had clarity of where we're going to start. So one of the biggest learnings that we got from that conference was the need for the situation analysis. We realized at that time there were about 15 countries that had done child protection mapping, had done a survey of the social service workforce. And so we, as a team, grabbed that and said, that's where we're going to start. And indeed, as soon as the team went back to Kampala, the government of Uganda constituted a technical working group and brought on board other stakeholders, the academia, other civil society organizations, for us to steer that plan. The other big highlight from the conference that we learned was the social service workforce framework. That framework, if you remember, the framework that we learned from the health sector that had those three components, like the Uganda team, we grabbed that framework, looking at the planning the workforce, developing the workforce, and then supporting the workforce. We used that framework to develop those concrete plans that Maury you're talking about. First of all, we first defined, remember in one of the presentations that John Williamson made, he gave us a framework, like the definition and the members of the social service workforce. So we were able to use those learnings to apply to our country. and continue to use the framework to develop our concrete plans. We had concrete plans on what we are going to do to plan the workforce. So we needed to do the survey immediately. Then we developed concrete plans. Yeah, what do we do? So it had a lot of learnings for us. And indeed, the Uganda team continued to work together as a team. We actually had a strong team at the Ministry of Gender, Labor and Social Development comprised of the different stakeholders. I can talk about what the universities did a lot, and then the parasocial workers and the in-service trainings that happened, a lot that happened because of that conference.
Great. Well, it's great to hear that you spelling that out, Grace. And I know in many countries, people will be thinking, oh, I wish we had that. We had some mechanism to really bring together the parties you talked about, someone from the government or a team department in the government, plus an openness to NGOs and willingness to learn from each other, but also having some university people, training people, professionals or academics who were focused on developing that higher level of the workforce is a very important component. So thank you for drawing all that out. But in terms of we've got a few more minutes left before the panel wraps up, but I wonder maybe Amy could just steer us into the way that the conference and the multidisciplinary components and the multi-sectoral components that we've just been talking about, how did that lead into the conference, lead into the alliance? Or so how did the alliance develop from there? I see also Zeni's ready to come in. So maybe either Zeni or Amy might want to pick up that transition to developing the alliance.
Okay, yeah, I'll go ahead. Well, again, I think we have Maury to thank for this because she was really leading the charge after the conference along with Gretchen and really continuing to rally behind the idea of bringing people together to continue the conversation after the conference, and provided a lot of support and structure for that through supporting a webinar series. And so we started webinars before the Alliance even got started. And as a way to continue bringing the participants together to really highlight some of the really innovative ideas that came out of the conference and things that were happening in different countries, and to really let those good initiatives be highlighted for others to learn from. And so that webinar series was created alongside all of the beginning steps of forming the Alliance, developing the steering committee terms of reference and identifying, interim steering committee members and, all the things that it takes to get a new network and organization off the ground.
Great. I mean, Zeni, are you happy to pick up on follow up from that about the early days?
Yes.
You've been on the steering committee from the beginning for a long time. Tell us about that early days for you and what were the important bits in there.
Yes, I was actually honored to be invited by Amy and the team to be part of the steering committee. And I think that what I brought in was the child and youth care focused, because I think the aim was to look at social service workers, not just social workers, and bringing in the perspective, the scope of practice, the definition of what child and youth care workers can contribute as a child-focused workforce. I was also privileged to be a part of the working group that looked at competencies for paraprofessional social workers. We went to a REPSI conference representing the Global Social Service Workforce Alliance in Zimbabwe, and what was clear in the feedback from workers, parasocial service workers, was that they wanted to be defined. They wanted an identity. They wanted to be called, even if they were auxiliary or para-level, they wanted to be called parasocial worker, para-child and youth care worker, para-community development worker. And that assisted us to come up with a set of principles to guide the development of workforce and competencies for these three categories of workers, which I think has been a useful document that has been utilized internationally. Amy and others might have more to say about it. So it was my privilege to be part of some of the workings of the alliance.
Okay. Well, I'm about to wrap up. So if either of the four of you want to just say a last word, looks like Grace is trying to get in there. Grace, have you got a last word?
Yes, I wanted to highlight the impact that that conference has had on many of the policies. And Mori talked about Uganda and then Ethiopia. One I wanted to highlight is that the paraprofessional structure became so popular and so successful in Uganda, with like coverage of over 72% of the country. And there was an independent study that found out that there was significant reduction of cases of child abuse where the parasocial workers were working, and Uganda has continued to implement. I just talked to a government of Uganda official a few days ago, and they were so excited about how much it has expanded, how it's part of the national child policy now. In Ethiopia, in Ethiopia, the same. The social service workers have been part of the national social protection policy, and it's continuing to influence the government's investment in people that matter for children. So there's a lot. Uganda achieved a lot. There was increase in funding allocation by 6 percentage points. There was increasing of staffing of the social service workers in about 4 years, from 41% to 57%. So there's been a lot of, the universities are continuing to teach child protection, which was never before in Uganda, and I understand there's been a lot of restructuring of the social service.
Okay, Grace. I love the way you've been concise and hit all those bullet points there. I need to bring you to a halt, and I really do need to very, very shortly return us to Kathy in our chairing role. But just to wrap up, just a few seconds from me, I do think there's something very rich here. We've done it quite quickly and informally, but you'll have heard the other panel members talking about these different components of the social service workforce, and the way that by mutual recognition and by giving time not just to different professional level trainings, but to the role of people who are trained at a lower academic level, and including some people who are trained but are volunteers, this has made such a crucial difference as Grace has been giving as examples, that really in many countries, and that includes a whole range of low, middle, and upper income countries, that if there could be this recognition of different grades of training, of different deployments of people, but where they're all valued and there isn't a competition between professions, where there's real recognition, for example, of child and youth care workers, but also where there is valuing of those who are at, so say, the lower level, because so often the low level, so-called, is the front line. Now, social workers are sometimes the front line, child and youth care workers are the front line, but also volunteers can be the front line, and trained and appropriately deployed and encouraged, they can make a huge contribution. So I think you've drawn out for us something that I believe is a valuable lesson that you all learned together, but has informed the Alliance, and why we call ourselves a social service workforce. I think you've all helped us to understand a little bit about the background of how that all came together in Cape Town, and how the Alliance is trying to hit all these many targets for development. So with that kind of wrap, I'll hand back over to Kathy.
Thank you, Ian, and thank you to our great panelists. You worked your magic. Across 13 years, you brought all that enthusiasm and energy of that conference to us today. So thank you. And now I'd like to turn it over to Hugh to talk to us about the Alliance over the years. Hugh?
Thank you very, very much. And it's great to be with you all. I'm Hugh Salmon. I'm now the director of the Global Social Service Workforce Alliance. Have been since 2020. So I'm standing on the shoulders of giants, some of whom you just heard from, including Amy. And I'm going to talk about a bit more of the steps that have followed since. So we've got this on our website, so you can all look at this. If you want to look at there's a section on the website under the About Us section that talks about our 10 years of progress. I'm just going to quickly go through these now, but by all means have a look at the presentation on the website afterwards when you have a chance. So we're looking back over the last decade, not just for the sake of nostalgia or retrospection. We really want to bring out the lessons that we've learned that other networks and alliances could learn on how best to develop, bringing people together from many different contexts, and also to highlight what we've achieved, what we learned from that, and what we still need to achieve. So here's a photo of that early conference, which has been mentioned a few times now in Cape Town. And that really was the sort of seed was germinated at that conference. You might even see in that photo some of the people that have just been talking. I think Maury is sitting there at the bottom right, if I'm not mistaken. But that was a seminal conference, as we've just heard. Moving forward a little bit, sorry, it's a little bit small, this diagram, but you can definitely find this diagram on our website because this was a really seminal point, and I believe it was first conceived at the conference. The development of this framework, which many of you now will be familiar with, which really looks at strengthening the social service workforce in a holistic way, thinking how to plan the workforce in terms of its numbers, its budgets, and the ratio that's required, or what you should be aiming at, and how to distribute the workforce in different roles. Developing the workforce is the second circle. It's around education, training, and building the capacity of the workforce. And the third circle is around supporting the workforce, all different ways in terms of improving the conditions of work, professional associations, improving supervision, and so forth. All of that, as the center of the diagram says, needs to be done within a specific country context. It's not one size fits all, but this is a model that can guide development. Some of you in the chat and in the Q&A have already said, how can we develop in our own country? Well, this will give you some idea, but there's many other resources on our website, and please contact us, join as a member and contact us, and we can provide you with further tips and guidance. And then, as Amy mentioned, we then started webinars before we even formally launched. And since then, we've had 50 webinars altogether on a range of different topics. And then we started to lay the foundation in terms of governance. So the first steering committee was formed and its bylaws created. And you can again see some of our steering committee members. Maury is again there. Becky Davis, who has since been our chair and is still on our steering committee. So a number of people who have been with us on this journey all the way, as well as Amy there in the background. So these are, part of the people that really helped lead the Alliance from the beginning, from many different countries and regions. And here is Amy, there's the first director, who was there for a good number of years. In fact, for the first 5 years as director, then followed by Betsy Sherwood, and then I joined. I had the privilege of joining in 2020. But all the time, there's been great continuity, and we've always been working together as one big team. So this form is the one that you can still fill in now to register as a member. And this was launched when the whole alliance was officially launched in 2013. And we started to invite members to join. And by the end of that first year, we already had 266 members across 46 different countries. And then we were bringing together stakeholders for collective knowledge. And the particular way we did that is through interest groups. This one is meeting in person, but they were also meeting online in online meetings like this one, and through email exchanges, and working together on joint areas of guidance. And so this one was the first one looking at the role of paraprofessionals, because as Ian and Zenny and Maury and Amy and Grace were all explaining just now, the distinctive thing that we really defined us from the beginning is understanding the broader social service workforce and how the paraprofessionals who don't necessarily have a university degree or not necessarily in social work, but they have some specific training and a clear role in delivering social services, how to knit them in the overall tapestry of the social service workforce alongside social workers and other professionals. So that was one of the early areas of guidance. And then we began to raise the status of the workforce through various means. And we had our first social service workforce week. in 2014, and we've been having them ever since. Normally, in this time in October is now when we have the Social Service Workforce Week to really bring attention to the importance of the workforce. Also in 2014, we began our first symposium, in this case in person. Unfortunately, I joined as director in the middle of COVID or the very beginning of COVID, so I actually haven't had a chance to go to one of these symposia in person, but I certainly hope we'll have one at some stage. But obviously, at that time we were meeting mainly in a building in Washington D.C. or in the U.S., which was great for getting people together. But I think now that we've gone online, we're finding that we don't have the cost barriers and the visa barriers and others of bringing people together across the world, let alone the carbon footprint. So of course there are benefits to the form of symposium that we have today. But this is one of the first ones in 2014, and today is the 8th symposium. We then started to look at different resources, and we were developing different ones and putting on our website, sharing via our newsletter. They're still there for you to access. And this was the first one that was looking at the composition of the social service workforce in HIV/AIDS affected contexts, which, as mentioned, was one of the early focuses of our work, and thanks also to the funding that we received from the US government, from PEPFAR. And then moving forward into 2015, we started to look annually at an overall view. Thanks to funding initially from GHR Foundation, we started to produce a State of the Social Service Workforce report. And that was not trying to tell everything about the social service workforce. Initially, it was a multi-country review. And then over time, we picked up on specific themes. So obviously in COVID, we looked at the impact of COVID in the workforce. We've also since then looked at the role of the workforce in humanitarian situations. And we're currently developing one which will be released in early December, which specifically talks about the 10 years that we have learned, what we've learned, not just as an alliance, but what have other people been doing, even outside of the alliance, in their countries in terms of developing and strengthening the social service workforce. So in this year's edition, which will come out soon, and also hopefully will be translated, you will be able to see the learning that we've been pulling together from interviews and desk research on that subject. In 2016, we came under the umbrella of TIDES, which is an organization in the US that helps nonprofits and NGOs like us to be registered in the US and to deal with all our HR and tax and finance and admin. So joining TIDES was a great step forward for us in 2016. And then we began to reach other key milestones, such as reaching 1,000 members across 91 countries in 2016. And then we developed a program called the Ambassador Program, which we ran for 2 cohorts of 2 years. And ambassadors were selected as key leaders and innovators in their own country that were able to work on things together by supporting each other and also representing the alliance, but crucially acting as a change agent in their own country on things such as drafting legislation or policies. And that was very critical. Unfortunately, we tried to bring them together in person. The first cohort met in the Rockefeller Center, I believe, and then in the second one in New York, and the second one in Uganda. But then COVID hit and we haven't been able to bring them together in person since then, but we're looking at whether we will have similar versions of this in future. And then we began, 2017 was a seminal moment because we shared a global advocacy toolkit for the social service workforce. And those of you who are familiar with our mission will realize that it is about sharing learning and bringing people together, but it's also about advocacy, and not just doing advocacy ourselves, but actually helping you as members to do advocacy in your own context. So this toolkit was really to strengthen advocacy on convincing people to invest in the workforce, to recognize the workforce, and to continue to support and strengthen the workforce. And then in 2018, we worked with a number of different organizations, in fact, 35 different organizations, to issue a call for action to strengthen the social service workforce, to better protect children, and notably to achieve the Sustainable Development Goals. So you'll notice when you go through our resources that most of the resources link the social service workforce with a particular theme or priority. So this one was linking social service workforce with achieving the SDGs. And then in 2019, we developed with UNICEF a very important guidance that particularly for UNICEF staff and programs, which was a global framework to guide countries in strengthening the social service workforce for child protection. So drawing on those three circles at the beginning, but in more detail, and you can also find that very useful resource on our website. In 2019, we had begun mapping the workforce and working with UNICEF and governments and other partners to do mapping and assessment of the social service workforce, and others such as Grace have mentioned how they've also done that in their own countries. So we did that in 3 regions in particular. This one looks like Mongolia as part of the work in East Asia and Pacific. We also did it in Middle East and North Africa and in South Asia in partnership with UNICEF regional offices. And that was a very important effort really in collecting data that can then be used to inform decisions and planning about how to strengthen the workforce, given what is known about the current gaps or strengths within a particular country. And then from 2020, we had a very important development, which was that the first time we had a region really adopt a particular plan to strengthen the social service workforce. And we'll be hearing a little bit more about that later from our colleague from Vietnam, which played a leading role, because this was, as a result of the mapping in that region, there was then a Hanoi Declaration in Hanoi in Vietnam, and that declaration brought the members of the Southeast Asian nations, the Association of Southeast Asian Nations, ASEAN, were brought together for this declaration on how to strengthen the workforce, and that led to a roadmap, which again we were part of, and we've been supporting the development and implementation of that roadmap ever since, and that roadmap will be for 10 years. So that was a really critical development. From 2020, we also began to develop some new partnerships and initiatives. And you can see there that we launched work with UNICEF at the global level, as well as some of our work at regional and country level. And we also began working on a new partnership with USAID under the Children in Adversity program, which we're still supported by today. And that's been a very important part of our development as an alliance overall. In 2020, COVID-19 started. So obviously, like many organizations, we talked to our members and we tried to learn from them how we should develop suitable guidance. And the first guidance that we worked on was ensuring worker safety during the pandemic. And that was a critical resource, very widely used and shared by our members. And then we were continuing to build the evidence base. We had over 1,000 resources in our database by that point. And now we have over 1,350 resources. So just to clarify, in our website, you can see a section on everybody's resources that we're just bringing from different people and sharing for other people. So it's amplifying resources developed by partners and members, but we also have a specific section on our own alliance resources. In the first time in 2021, we did that mapping and assessment with UNICEF in South Asia, but specifically on mapping the justice for children workforce. In that region, we'd looked at the overall social service workforce, but at this point, we were able to go into more specifically, what does the workforce do in the area of justice? And that was a very important moment to understand and compare across the 8 countries in that region. In 2021, we were convening more members and we'd reached a milestone of 3,000 members across 145 countries. And we were beginning to look at the social service workforce in different sectors and contexts. So traditionally, social service workforce is thought of as part of the social welfare sector, and sometimes social workers are sitting in social work offices, but also they're often in schools or linked to schools or in health facilities or hospitals or community health centers, and sometimes in courts and justice settings too. So we began work on guidance with the support of UNICEF and USAID, and also in the East Asia Pacific region, we've developed guidance which is also accessible on how to strengthen the workforce in linking with or working in those other sectors such as health, education, justice, and also in humanitarian situations, crucially, which is I'll talk about a bit later. And so coming up almost today now, we're talking very much at the moment about how to ensure the workforce is properly planned, and that's prioritized in national budgets, which has been a big challenge all along, because people feel it's easier to work out how much it costs to have teachers and doctors and nurses because they can count those easily in terms of schools and number of students, number of patients that go to a hospital, etc. But there was vagueness about how do we quantify the number of social service workforce needed and how do we cost them. So we've now issued initial guidance on calculating the ratio of optimal ratio for social service workforce to a given population, and also then how to go about costing. And we're now bringing people together to strengthen that guidance, as I'll mention in a minute. So at the moment, we're looking forward to a future of promise. We have a range of initiatives which are just getting going, and I'll talk about those a little bit later. But I really want to give time for the rest of you to participate, and please continue to put your questions and comments in the questions in the Q&A and comments in the chat, because we really want to hear from you. And in the Jamboard, I'll try and bring some of your ideas in the Jamboard into what I say a bit later on. Thank you very much.
Thank you, Hugh, for an impressive reminder of all the significant and timely work that the Alliance has done over the years. And as Hugh said, keep contributing to the Jamboard. At this point, we need to jump into our next panel session, in which we'll explore county-level progress in strengthening the social service workforce over the past 10 years, as well as continuing and emerging challenges in the countries of Romania, Vietnam, and Rwanda. We'll start the presentations off by hearing from Dr. Florin Lazar, who will speak to the context of Romania. Dr. Lazar?
Yes, thank you, Catherine. Thank you, the Global Alliance, for the invitation to present our experience and what we have managed to achieve in the past 10 years in terms of social services workforce provision and strengthening in Romania. My background is in social work, and I cannot help myself by acknowledging that many of those involved in the 2010 kickoff meeting, so to speak, were involved in HIV, an area where I worked for 10 years here in Romania before joining For Good academia. And currently, I'm also vice president of the National College of Social Workers from Romania, and trying to build the social services workforce in Romania. A bit of the context about the Romanian experience. Social work in Romania was established almost 100 years ago in 1929. It existed at university level until 1969, but then communism came over and decided that they no longer have social problems, so why would they need social workers to deal with? But in the 1990s, soon after the communism fell, it was re-established, social work education, and at university level, and from then on, we have had many generations of graduates in social work. However, after more than 3 decades, after the fall of communism, we still have unqualified staff providing social work activities. In 2004, with support from USAID, World Vision, and other international NGOs, we managed to create a law on the statute of social workers, and 1 year after, it was created a National College of Social Workers. So social work profession became a regulated one in Romania. More recently, in 2018, as a follow-up to the UNICEF call for action on social services strengthening, which in Europe and Central Asia, which was held in Bucharest, gathering people from all around the region, the Romanian government committed to work towards having no longer unqualified professionals in roles requiring competences gained after education, higher university education, by 2030. So to align this on this call, we have worked together with UNICEF and the Romanian government to make sure that in a few years we'll reach this goal. And we started all from this graph, maybe that you might be familiar with, which is one of the outputs of the Global Alliance, in terms of how do we see the social protection system workforce more general by different types of competences required on the occupational level and qualifications needed for each type of activity, either in social services, direct social services, or in allied services. Some of the accomplishments that we have managed to have in this past decade started in a way with creation of a social work research commission within the professional body of social workers, the National College of Social Workers, which was in 2016 officially. But just before that, we started several research carried out on social work workforce, starting with social workers, a profile in 2015, and then we looked at the qualifications of those working in social services throughout the country. So we gather information from all over the country, and we discovered that only about 1/3 of those were qualified in social work. So we have had one of the outcomes of this was a proposal to the ministry to reduce this unequal distribution of the social services, rural, urban, but also regional. And then we started our studies among social workers to look at their working conditions with another study on the situation of social workers throughout the country, with almost 1,000 social workers responding to that in 2016. Then we managed to get some funding from the Ministry of Research or Ministry of Education for more extensive and mixed methods research that we did. We looked at the public image of the profession and of the field. We had this image of social workers in the media. We did content analysis of media reporting about social issues and social workers in Romanian newspapers, electronic versions. And then we started our partnership with. Actually, we started a bit earlier, but this is when we published some of the research that we've done together with UNICEF on strengthening the workforce of the services in social services in Romania. We looked at the competences of social workers. We looked at the legislative analysis and identifying the gaps and the needed changes in the legislation. Then we created, based on these two, we created a code of practice for the social workers active in the services, and created an e-learning platform, a portal for social workers for their continuing professional education. Other initiatives were related to the competences of those working in the social field. So again, a more general approach. Then we organized, though virtually due to the COVID, we organized at the University of Bucharest the 10th European Social Work Research Conference, moved from 2020 to 2021. Then we continue in our partnership with UNICEF with a mapping of the initiatives to incentivize the employment of social workers across Europe, and trying to provide more evidence to the Ministry of best or good practices around Europe that can be used in order to address the shortages in the social services throughout the country. We just launched this year, a few months ago actually, we launched the first social services workforce census with the support from UNICEF and the local authorities. And this is actually we hope that it's the first in a series of censuses that we will manage to carry out from time to time, every 2, 3, or maybe 5 years. We'll see, depending on the needs that on the changes in the workforce. Currently, for instance, I'm coordinating another research which looks at more workforce-related issues on working conditions, namely the mental health of social workers and ways to improve. And we're testing several interventions in order to reduce the negative consequences of burnout and stress, and see which one works best to use in the future. And here are some of the cover pages of some of our books, which were published in Romanian. From some, we managed to publish also some English articles. And this is the cover page of our recent census of the workforce in social services in Romania, that it was made public just a few weeks ago, actually. And we are in November, we will have also the full translation in English to be available on UNICEF and National College of Social Workers web pages, and disseminated, I'm sure, through the Global Alliance afterwards. Above, you see our portal, our e-learning platform that we are using for social workers, in which they can consult that any webinar, any activities, or other resources that we are preparing for them. And again, our research commission, for instance, works continuously to create materials and to support the use of evidence in the interventions carried out at grassroots level. When you look at the image on the left hand side, you see the code of practice on the social workers, in which we managed to gather necessary information for the employers, for also for the employees, about what kind of activities can be requested depending on the experience that they have, and the competences that they need in order to achieve all those activities. And on the right hand, you see another report on the competences of the future for the social services in general. Some of the challenges that we are still facing are related to the unqualified staff performing specialized services. The situation improved a bit, but we are still in the process of addressing this. And in this case, we have concern and trying to create measures to encourage graduates to stay in the field. Then we have an uneven distribution of qualified staff, mainly in urban and the big cities and around the university centers, and less in rural areas. And maybe would be a surprise, but 45% of the Romanian population still lives in the rural area, whilst only about 12 to 15% of social workers are working in rural area, for instance, just to have an idea. The next challenge is related to case overloads, and which was aggravated during the pandemic, as some of our colleagues left the profession or moved to other places. So the fewer.
One more minute.
Yes, thank you, Catherine. So we are now working on finding ways of deciding on what's the appropriate number of cases that can be handled. Then in recruitment and retention, and as I said, attraction of graduates and keeping those who are already working in the profession, professional supervision, which is not yet regulated, and we are working on this. Staff stress and burnout, which is related to retention in the field, and continuous professional development. The priorities for the coming years actually are part of the College of the National College of Social Workers and the UNICEF partnership related to strengthening the social work workforce in terms of regulating supervision and CPD, and making sure that we have means to attract, to recruit the social workers in disadvantaged area, and finding financial mechanisms to support this, address gender, disability, and ethnic balance at all level of the social services workforce. Try to find incentives to support deployment of social workers and other professionals with university education in excluded communities, and also adequate paid and working conditions, which is fair across the workforce. Nevertheless, as 90%, almost 90% of those working in social services are women, we need to ensure that we can have investments in workplace safety and dignity. Thank you all, and I'm here for your questions or comments if you have one. Thank you.
And we may come back with some questions, but at this point, I'd like to thank you, Florin, for an amazing overview of what's happening in Romania. And now we would like to move to Luan from Vietnam.
Thank you, Dr. Cathy Waymond, and warm greeting from Hanoi to all colleagues and friends. It's my pleasure to speak about social service workforce strengthening in Vietnam. Social work, in my presentation, I will talk about the achievement in strengthening social service workforce in Vietnam, the challenges the workforce face, and a priority for future social service workforce strengthening. Yeah, could you move to the next slide? Yeah. Could you help me to move to the next slide, please? Yeah, so social work is relatively new in Vietnam. Social work development officially started in Vietnam in the year 2010, which coincide with the Cape Town Conference. And in Vietnam, UNICEF has contributed to the many important work and achievement on social work development and social service workforce strengthening. Next slide, please. So in the next slide, I will talk about key achievement in the previous one. Yeah, on establishing the very first national framework on social work development in Vietnam. So in the past 10 years, Vietnam has enacted very important legislation and policy to allow the development of social work in Vietnam. So first legal framework for developing social work in Vietnam was only adopted in the year 2010, and it served as a national strategy to develop social work profession by 2020, and also a strategy to create a system to deliver social work services across the countries. And based on the national plan of action on development of social work, the government developed and promulgated circular, including basic circular to regulate the professional code, salary scale of social worker. And in the sectoral ministry, the Ministry of Health also developed circular to regulate the development of social work in health sector and development of social work in education sector by the Ministry of Education and Training only in the year 2018. And Vietnam is now in its second national plan on social work development until 2030 to further strengthen social service workforce. In the broader framework, the National Program on Renovation and Development of Social Assistance System to 2025, Vietnam aspires a ratio of 1 professional social worker per 5,000 population. At the regional level, Vietnam has led in several important initiatives of ASEAN on strengthening social service workforce, and Vietnam has received valuable support from UNICEF East Asia and Pacific Regional Office, as well as from the Global Social Service Workforce Alliance. In 2020, when Vietnam was the chair of ASEAN, it coordinated the development of the Hanoi Declaration on strengthening social work toward a comprehensive, cohesive, and responsive ASEAN community. And in the next year, it developed a 10-year roadmap to implement the declaration, which was also endorsed at the 2020 ASEAN Summit. The declaration and the roadmap provide a robust framework to accelerate action to strengthen the social service workforce in ASEAN to respond to the need of all vulnerable groups, not only children, but other vulnerable groups. In the next slide, I will talk about key achievement of Vietnam in education and training on social work and social workforce development. Social work was only recognized as a discipline at university level in the year 2004. In the last 10 years, the number of training institutions in Vietnam has increased remarkably from 2 in the year 2004 to 34 at present, of which 7 offering a master degree and 2 offering PhD program in social work. Every year, about 2,000 students of social work are recruited. As the current social service workforce in Vietnam is largely untrained, about 10,000 social service workers have received in-service training on basic social work and child protection. Next slide, I will talk about the key achievement related to the development of system to deliver social work services. From having no structure before the year 2010, systems have been established to deliver social work services in the health, social welfare, and education sector. Social work unit has been established in all central and provincial hospitals by today, and 90% of district hospitals have a social worker. Social work service center and social work offices have been established in the social welfare system at provincial level. And social work services in school are being developed, covering all levels of education from early childhood to secondary school. And very importantly, child protection systems are being established in all communities in Vietnam to put forth case management for vulnerable children. And next slide, I will talk about the challenges. So Vietnam, next slide, please. Despite the great achievement, Vietnam still faces several challenges in strengthening its social service workforce. Vietnam still has insufficient legal framework on social work. Until today, Vietnam lacks a law on social work that it failed to define who is a social worker and who is a paraprofessional social worker. There are no regulation and standard for registration of social worker. The role, power, and function of social worker are not clearly defined in the welfare, health, education, and justice sector. And there is a lack of allocated budget. And in turn, it affects the work on strengthening the social service workforce and negatively impacting the reach of social services. There are no established funding sources for several circular promulgated. Next, I will talk about the challenges regarding the lack of.
You have 1 more minute.
Yeah, lack of a network of supervisors, and also that recently the social workforce is shrunk due to the government policy on reduction of civil servants. So the country's the social service workforce in the country is still largely staffed with untrained and paraprofessional, and still there's a lack of understanding on the value of social worker. I now move to the key priority. Yeah, next slide, please. So Vietnam, we need to continue to strengthen the legal framework on social work. UNICEF is advocating the government to develop a social work law, and at the same time to amend and develop and to integrate the role and function of social worker in the specific law which are being developed or amended, including the law related to children, family, mental health, criminal justice, and also develop a costed social service workforce strengthening. So Vietnam plan to conduct a mapping and visioning of child protection system and social service workforce and define the ratio of professional social worker per targeted population through the thorough analysis of priority target and scope and nature of the services. So Vietnam will also do a costing of the social service workforce plan to ensure that good financing for the plans. Next slide, please. Last slide. Yeah. So other priority including continued improvement in social work education and training, and it is critical for Vietnam to develop professional competency standard for social worker working in different sectors. And as a system still rely on untrained worker, so it is very critical for Vietnam to develop systematized competency-based in-service training program for manager and frontline worker who have different training background but are working in the social welfare, health, education, and justice sector to deliver social services for vulnerable children and family and people. And last is the plan to develop a network of supervisor. Thank you. That's the end of my presentation. Thank you very much for your attention.
And thank you for your very comprehensive overview at lightning speed. Much appreciated. Now, we would like to go to Luan Mwani of Rwanda for his presentation. Leon?
Okay, thank you so much. So I'm making this presentation on behalf of UNICEF Rwanda and the government of Rwanda, particularly the National Child Development Agents, who have been quite, at the leadership front in terms of developing the social services workforce in Rwanda, particularly with support from USAID. So for one, in this presentation, I'm going to give a general background of where the development of social service workforce came from. And I'll look at key milestones since 2012 and the role of the community workforce, as well as planning and recruitment, as well as workforce development of the social service workforce. In terms of the background, so post 2010 conference, Rwanda carried out, next slide, Rwanda carried out a national survey on institutional care that basically established that there were 323 children in institutional care, which sort of gave the impetus to say we need to do something. And that led to the landmark, to the development of the strategy for national child care reform, which sort of gave rise to a project in 2013 known as the Tubarere Mumriango, meaning let's raise children in families, which was supported by USAID and continues to receive support from USAID up to now. And it's from that foundational, from those foundational processes that the need for social services workforce developed. So prior to that, there wasn't any directly recognized social services workforce, particularly focused on child protection. Next slide. Right, so in terms of the key milestones, as you can see from what I've said, from 2012 development of the National Child Care Reform and the TMM program, came in 2013, the launch of the TMM program and the recruitment of the first cadre of social services workforce available for children. And those were 34 social workers and 34 psychologists. And that's also included development with the local university, the University of Rwanda, and supported by Tulane University, development of pre-service and in-service training guides. So the first sort of planning and putting in place of the very first foundational team of social service workforce in Rwanda started in 2013. And along the way, and these were placed in institutions directly supporting deinstitutionalization of children. And I must say, with that support of the social workforce that began in 2013, Rwanda now boasts of over 90% of children in family-based care out of institutional care. Come 2016, an important milestone came with the development of the paraprofessional social volunteer workforce known as ISU in Rwanda, which basically is Inshuti Zumriango, which in English means friends of the family. That workforce numbering about 29,764, which is 2 per each village in Rwanda, 1 man, 1 woman, remains available to support, to support the professional workforce with a lot of the prevention, with a lot of follow-up work and family visitation support. I will talk a little bit more about the community workforce along the presentation. And then in 2018, another important milestone was the absorption of 30 out of the 68 social workers and psychologists. So the 68 were recruited on contracts, externally supported, paid for from UNICEF funds provided by USAID, but not necessarily as part of the government employee team. But in 2018, government absorbed 30 of these who are now up to now part of the government workforce available for child protection. This also included development of new job descriptions and expansion of roles for these social workers and psychologists from a predominant focus on care reform to a general duties related to child protection and covering the entire district, not just an institution. In 2021, there was a development in the sense that the social service workforce, the 30 absorbed by government, moved from short-term contracts to longer-term contracts. And also, we, UNICEF, together with government, supported the re-registration of the Rwanda National Organization of Social Workers. So another important development on the overall social services workforce landscape. 2022 to 2023, we have seen 32 additional social workers and psychologists are engaged to support a recently developed child protection case management system, and also development of support supervision framework for the social service workforce, which is still ongoing. And initial discussions have started with the Rwanda Allied Health Professions Council to consider practice regulation for the social services workforce, while the social work community works on having a clear and dedicated regulation mechanism for social workers and other paraprofessionals. Next slide. And I'm going to give you a 2-minute warning. Okay, sure. Yeah. Thank you. But not yet now, right? In terms of the community workforce, basically the community workforce, the issue that I talked about, which number 29,674, are supporting at community level. They are known by the community. They are always available and they go to people. And their supports mostly cover around prevention, interventions, response and coordination, community outreach, monitoring, and reporting, which are distributed through what I've provided there as main areas. You can move to the next slide. All right. In terms of planning and recruitment, currently the social service professionals recruitment process is done in line with the government-wide recruitment process under the Ministry of Public Labor. So they are still on contract in the National Child Development Agency, but they are recruited by the government through the normal processes that all other civil servants are recruited. So that's a giant step towards institutionalization of the social services workforce, particularly for child protection. When it comes to the paraprofessionals, there is the guide that was developed to guide the selection which communities use when it comes to selection of the ISU. Next slide. Right, then there's continuous workforce development, particularly in service training. I will not go through each and every of those listed different areas where capacity development has been ongoing and continues to be provided, both for the professional and for the paraprofessional workforce. Next slide. Right, so this is just to give an example of how the development, particularly of the community workforce, has moved over time. So as you can see, every year there are some capacity development activities, and you can see the numbers reached, close to 500,000 children reached by the community workforce every year. Except in 2020, due to COVID, there was no training, but you can see they still remained available and continue to reach children. Next slide. Right, in terms of the challenges, I will not go in detail, but one, the issue of practice regulation, which I mentioned, the issue of the child protection workforce not yet included on the civil service structure. We still see gaps in terms of engagement with the academia, particularly in strengthening pre-service training. The need for continued professionalization is needed. And support supervision. We are about to start going into workforce mapping, so that still remains a challenge because we're not quite sure of the breadth and extent of current workforce. And then issue of funding, that's a big issue when it comes to supporting the sector and particularly the workforce. In terms of priorities, next slide. Right, so future priorities, particularly in relation to practice regulation, we're looking at strengthening work with the associations and regulatory bodies, supporting practice regulation and the social services workforce that I talked about, and strengthening human resource management information systems for social service workforce. Important to continue advocacy, particularly in building an investment case and engagement with all government sectors, and continued professional development and in-service and out-service training. I think that's the last slide. You can go to the next slide. Thank you.
Thank you very much, Leon, and thank you to a great panel working at lightning speed. At this point, we probably won't be able to manage a lot of questions, but we'll try to follow up. And now I would like to turn it back over to Hugh. Hugh?
Yes, thank you so much, Kathy. And I've been busy trying to answer your questions in the Q&A, so please continue to put those. And I would urge all other panelists to look at the Q&A, and if you see a question that's for you, even one that if you click on the ones already answered, I think there might be some more information that you could add on that. And also just to urge people to continue looking at the Jamboard, because I would like to look particularly at that second slide. If you just use the arrows at the top, when you've got the Jamboard open, you could move across to the future of promise. It's currently blank. I certainly hope not. I have some ideas, but it would be good to hear from you on that one. Maybe Elena could put the Jamboard link once more into the chat. Okay, so if you move to the next slide, I'll just really try and gaze into a crystal ball now very briefly. because we still have one more speaker after myself. And I just really want to look at some of the things that seem to be emerging as future global challenges that the workforce will need to face over the next 10 years. Sometimes summarized, I think my colleague Philip from Maestro summarized it very well as 3 C's, but I've added an A to this one. So the 3 C's being climate, conflict, and COVID, and the A being aging. But climate is really the big one, is the huge one that's affecting all of us, and climate change increasing the frequency and intensity of extreme weather events, increasing the risk of drought and famine. But all countries in North and South, rich and poor, have been affected by climate change already, and that is resulting in loss of livelihoods, sometimes loss of family members, which of course has long-term effects, but also displacement and migration. Also causing a lot of disruption and a lot of loss and pain and trauma is the impact of conflict. We're seeing that playing out right now in the Middle East, as well as Ukraine and Yemen, Sudan, and the Sahel region. Many other places still have active conflicts which are affecting people in so many different ways. And the social service workforce really needs to be ready to respond, as you see in this photo, providing immediate help to people who've been displaced, and not just through international organizations, but also as the local workforce. Future pandemics. So we've had COVID-19, and we know that we're at risk of another similar pandemic because we're such a globalized, connected world. And we know that some of these viruses can develop very quickly. So we've learned from the pandemic in how to adapt and respond, but we need to be ready to do so again, and possibly in different ways going forward. And particularly dealing with the lack of trust in official information, because that is very corrosive and very worrying. If the government puts out official information and scientists put out information and warnings, or try and promote vaccines, or trying to just safeguard public health, and people don't trust that information, then we're all at risk. And that is also happening in conflicts with disinformation being spread, and also with people who are thinking that climate will not be affecting them. So the social service workforce has a role to share information, to build trust, and to really help people help each other, as well as strengthening the resilience of populations. But we're also facing an aging population in many countries. We have a very large number of children and child-dominated populations in some countries, but we also have more of an aging population in other countries. And often those countries are not currently well prepared with the number of social care workers and the wider role of the social service workforce in coordinating care for an aging population, particularly with the increase in rates of dementia and other long-term health conditions. So that's looking at the global context. Just moving forward to the next slide. Looking specifically at what we do in social service workforce strengthening, we're going to continue a few things that we've just got started with. So we definitely, moving forward, we see a huge demand for making a solid case for investing in the social service workforce. We've also had chats and comments about that today. People are asking about ratios, and they're asking about costing, because we use workforce to population ratios to really help us plan and make a case for getting better investment from state and from other donors in the workforce. And then also we have very clear guidance that we're developing on how to do long-term costing for the workforce, and that will help strengthen investment. As I've mentioned in a chat, it's not a one solution, one magic number for all. Each country needs to develop its own ratios and its own costing. We've also seen over time the need for a holistic competency framework. So not just lists of skills, lists of knowledge, lists of facts that you need to learn at university, list of books that you need to read, but actually what are the practical competencies? What are the ways that you need to work with a child, like in this photo, or with a family? What are the ways to do that in a practical way so you can be a safe and effective practitioner? That requires a whole competency framework that combines knowledge with skills and with attitudes and values. And we need to have a framework for developing that covers not just professional workers, but paraprofessionals and volunteers as well. And supervision, we've issued guidance on that, but we need to continue promoting the importance of supervision, because it's a stressful job. We often have burnout. We often need to think through complex cases, and we need to develop in our own professional practice. And that requires supervision, which is not just somebody checking up on you. The supervisor is supporting you in your learning and development and helping you become a reflective practitioner that thinks carefully on your own personal biases, thinks carefully on the impact of your own experiences on the way that you work, and trying to improve the way you can work with families and others in need. Next slide, please. So we also want to look at more ways that we can strengthen the workforce across the divides between professionals and paraprofessionals and community volunteers. We need to extend our work to not just the area of children and families, which we have worked on quite a bit so far, but also people with disabilities, older people, as mentioned, people with mental health needs, and refugees and migrants. These are all the people that the social service workforce works with. And so we would like to work with more of you who work in these different areas and develop more useful guidance across these areas of work. And we also need to really hear from the people who have lived experience of social services, children who've grown up in care or had a social worker or not had a social worker but needed one, people who have had that experience. We need to hear from them to see how to strengthen the social service workforce, particularly in its day-to-day work, not just what's written on paper about the workforce, but actually how the workforce behaves in practice, how it supports people. To strengthen that, we need to hear from people who have been on the receiving end and who can be part of making a better future for all of us in terms of the quality of social services. We've just started that in a project which I'll mention in a minute. Next slide, please. So we have some things coming up right now. So we're doing some, we've got a partnership with UNICEF. We're going to have a webinar to launch the UNICEF Disability Inclusion Child Protection Competency Framework is coming up soon on the 7th of November. Watch out for the State of the Social Service Workforce report, which we also hope to be able to issue in translated versions. Apologies for those who have been asking for French and Spanish interpreting. We don't have it today, but we're going to try and have more subtitles and more translations in other languages going forward. We're going to have an updated website in early 2024. We're going to have a brief on the role of the workforce in care reform also coming out next year. And we're going to be looking at the care experience youth that I mentioned. We've got support from the Martin James Foundation to look at how people with direct experience, that their voices can strengthen social service workforce practice. And finally, on ratios and costing and making that investment case, we're working with governments in many regions. In fact, 4 or 5 regions have active groups to discuss how they're using ratios and costing, and that will help us in turn to improve the guidance that we're going to issue to further strengthen this important element of making the case for investing in the social service workforce. Next slide, please. So there's a wide range of different ways that you can support us, and we're always looking for new partnerships with grant-giving organizations or others. We are soon to launch a Circle of Champions program with an individual giving program, but also an opportunity for corporate partnerships. So if that's something that interests you, more information will be coming out specifically on Giving Tuesday in the US, 28th of November. So watch this space if you'd like to become a supporter of ours. We're giving a regular gift. And also, anybody can give a gift at any time on our website. You just need to go to the website and look for the giving button. And we're very happy to receive one-time or recurring donations. Because although we've had some very crucial partnerships with UNICEF, with USAID, and with others that I've mentioned, those aren't permanent. Many of them are coming to an end quite soon. So we need to always diversify our funding base so we can grow and continue to be as effective as possible and to reach others that we haven't reached so far. Next slide, please. So I think that we're going to be wrapping up quite soon. So I think that that's the end of the slides that I'm going to share right now. And I'm going to hand back to Kathy, who's going to hand over to Shima from UNICEF. Thank you.
Thank you, Hugh. I'm now going to turn things over to Shima Sengupta, the new Director of Child Protection at UNICEF HQ. We're extremely privileged to have Shima here with us today and are always grateful for UNICEF's continued dedication to the social service workforce. Shima?
Thank you so much. Thank you for inviting UNICEF to give these closing remarks. I actually joined, I listened to the last, well, almost all of the second last speaker and the last one as well. And I can tell that it's been a very, very interesting discussions, and I've been looking at the questions that are coming up. So really clearly something that everyone's appreciated, and there's so much to do and so much going forward, which is always, to me, extremely interesting. So honestly, I'm delighted to be here to celebrate the progress, the innovation, the dedication of all social service workers from across the globe. It's so interesting and so exciting. I am, by training and profession, I used to be a clinical psychologist, and I did work obviously very, very closely in teams with social workers. So I'm a little envious of all of you who are still practicing, and I'm here, I'm not. And, so I can tell that it's so exciting. So thank you. This is really, and again, from what I saw towards the end of the session, I think it really is a moment for all of us to reflect on our collective achievements, share valuable insights, and of course, charting the course for the future. And as was mentioned just now, the course for the future is almost always the course for now. When you look at the situation around the globe now, it is, and I think Hugh mentioned it, it really is what we should be doing now. And while we chart for the future, there's always something that's in the present and now. So again, I think, this is a good time to have this discussion, and I'm sure you've got really good insights on that one. While I am new to UNICEF, as was mentioned by Catherine, I'm not new to UNICEF, I'm the new director. But I do know that UNICEF has been part of this alliance since its inception way back in 2013, and we continue to be actively engaged, including through the steering committee, where I know I do have two of my colleagues, Kirsten and Aaron. So at UNICEF, because of what we do and where we work, we know all too well how critical the social service workforce is for child protection. And child protection is just one of it. It is, it starts with child protection, and then it kind of reaches the others as well. And honestly, social service workers are absolutely essential to identify the risks to children, to support the families and the children to overcome these situations. As you all know, I shouldn't be saying, I'm sure you all know this, they're often the first to respond in any case of violence, abuse, neglect, exploitation, all of this. And their ability to perform and the impact of their work really depends on how well they receive proper support in terms of political, human, financial. And that often actually comes back to us. How do we support this workforce? What do we have in place? I think that's extremely important. I've been in UNICEF now over 2 decades, and during my time, I've worked in low, middle income, low income, and even upper middle income countries. But wherever it has been, whether in situations which are strictly development contexts or humanitarian contexts, where we've had, very varied social or political contexts. In all these contexts, what is common is how essential a qualified, well-supported social service workforce is to child protection. And, 2 decades ago, as many of you on this forum will know, the many, many countries didn't have this. You didn't have social workers coming together, alliances, qualified ones. And so, one of the things I've done throughout my time is actually advocate with the governments we have worked with to give attention to this as a priority, but not just with the governments, also within UNICEF, across, I think child protection in UNICEF understood this very early on, but it wasn't the same with the others. So it's also meant that how we, that we really had to start in-house, start advocating in-house before we could go to governments, to other partners. And now I'm quite happy to say that, I joined this role from Iraq, and I used to be the representative in Iraq. And I took great pride and pleasure in going to the social services ministries of Iraq, or, or the semi-autonomous Kurdistan, and have these conversations with them and try to say how important it is. And I have seen how, governments are beginning to listen. They have listened, and they are beginning to give the attention and the priority to the social service workforce and sector that it deserves. So this is gratifying. Child protection laws, policies, and services simply mean nothing if there's no motivated cadre of social service workers in place to drive the system and to help the most at risk and vulnerable children and families to get the support they need. And this is what we keep telling our partners, our governments, our stakeholders. This is what we need. Recognizing the centrality of the social service workforce to any child protection system. UNICEF's Child Protection Strategy and Strategic Plan, as many of you may have seen and read, actually identify the social service workforce strengthening as a key strategy to strengthen the child protection systems. As you know, or you may know, we work in more than 150 countries to support national efforts to plan, develop, and support the social service workforce for child protection. And, these countries vary in many ways. So if you look at Indonesia or Ethiopia or Ukraine, we see how the social service workforce can transform how children are protected in each of these different contexts. And that's why it is so exciting, and that's why it is so essential. This partnership, and that's why for us, this partnership with the Global Social Service Workforce Alliance and UNICEF, it is really crucial. It has been crucial, and it will continue to be. And this partnership for us brings together the Alliance's expertise in advocating for a skilled workforce and UNICEF's global influence and reach on the ground to strengthen the social service workforce. The Alliance, I know, has contributed significantly to how UNICEF supports governments and civil society to raise the profile of this very critical workforce. At the global level, the partnership has been instrumental in the development of vital resources and guidelines, such as the guidelines to strengthen the social service workforce, mapping toolkit, the guidance for strengthening the supervision of the workforce, and of course, most recently, a seminal piece of guidance on developing costing and calculating ratios for the social service workforce. The Alliance has also worked closely with all our regional offices and several of our country offices to adapt and support the implementation of these resources, develop national legislation, promote establishment of networks and alliances of workers, and so on. So this partnership has had many areas of collaboration. Together, these resources and the Alliance's support have improved the quality of services that government and partners have been able to provide to children, to their families, communities, and governments. Are we there yet? I just said We've seen a lot of improvements. In my 2 decades, I've seen enough improvement to give me hope, to make me optimistic. But is it enough? No, not yet. We still have quite a bit to do. And actually, with this partnership, I'm confident that we will get there. So in closing, I would like to extend my heartfelt gratitude to you for your unwavering dedication and passion for the social service workforce. As we celebrate the Workforce Week, let us acknowledge the tireless efforts of good social service professionals worldwide and express our appreciation for their resilience, their commitment, and the tireless way in which they continue despite very difficult circumstances. Our journey doesn't end here. It's just, like I said, it's a milestone along the path of progress. So let us today renew our commitment of working hand in hand, sharing knowledge, and continuing to strengthen our partnership with the Global Social Service Workforce Alliance. Thank you so much. Thanks.
And thank you, Shima, for your inspiring and appreciative words. I want to also thank our wonderful panelists and speakers and all of you who participated today in our symposium. We really appreciate you. We want to keep you close. What started as a vision in Cape Town has brought significant benefit to the world. And looking to the future, we need to recognize, as Shima said, our work is not complete, and we need to continue to respond to the new challenges that Hugh talked about in his remarks. And we also need to support the thousands who work in service to their communities. Thank you again for joining us, and I hope you'll take a moment to fill out the brief pop-up survey that will come up after we close today. I can say I am hopeful, excited, and inspired by what the next 10 years will bring for the Alliance and also for the social service workforce strengthening as a whole. I hope you continue to stay on this journey with us. We need you. We have an ambitious future agenda. Thank you and goodbye.